get started, I think. So welcome and thank you to everybody for joining today's session. We're going to explore the We Don't Fit report, which is around, specifically delves into the lived experience of families affected by childhood dementia around Australia, focusing in on their interactions with care and support services. And I'm delighted to see that we have some families online today as well. My name's Gail Hilton. For anyone who doesn't know me, I'm the head of programs for care and quality of life at the Childhood Dementia Initiative, and have been on board with the initiative since we started, and have had the absolute pleasure and privilege of meeting many families around the country and listen to the experiences of interacting with health and social care systems, and just the challenges that can bring and has brought for very many families. So we'll unpack that today. Before we get started, I'd like to acknowledge the traditional owners of the land on which we meet, which will of course be different around the country, with this being a virtual meeting. Here I'm in our Brookvale office, and the traditional owners of the land are the Darug people, and I'd like to pay my respects to elders past, present and emerging. And of course, how wonderful will it be if we have a yes vote at the weekend. By way of an agenda, let me just move my slides. We will aim to finish this up within the time frame. So this we aim to finish at about 1:30, and I'm hoping that we will have plenty of time for some discussion and questions and answers at the end of this presentation. I am presenting without a family alongside me, but I have endeavoured to include videos of families sharing their experiences, which is often the way that families would choose to communicate their experience. But this is obviously about family experience, and I'm simply the voice piece for that. I thought we would just start by doing a very quick recap on what childhood dementia is for anyone who's not too familiar. A brief introduction to our Family Advocates Programme, so you can understand how at the Childhood Dementia Initiative we harness and amplify family experience and voices. Then we'll delve into the We Don't Fit report, what we did, how it was done and what we found, really importantly, a touch on some other emerging research, and then I hope to focus in a little bit about some other information we've got from families about what families want from health professionals. So plenty to cover. Please feel free to type into the chat function. I'll probably keep the presentation moving, but we can address any questions towards the end. As with every presentation on childhood dementia, just to highlight that there is always some emotional content, and this can be a really challenging subject to talk about. So please do what you need to do to keep yourselves feeling safe and well. So I'm going to kick off with a 2-minute explainer video. Many of you might have seen this before, but just to recap on what childhood dementia is.
Childhood and dementia. Two words that shouldn't go together, but sadly, they do. Sadder still is that on average, childhood dementia takes a life every 11 minutes. It also takes away the future. So, what is childhood dementia? Childhood dementia results from progressive brain damage caused by over 70 genetic conditions. Just like adults with dementia, children with dementia experience memory loss and confusion. They have difficulty concentrating, understanding, learning and communicating. And they can experience severely disturbed sleep and personality changes too. They can also have behavioural and emotional issues like hyperactivity, anxiety and fear. Each child's experience with dementia is unique. For some, symptoms can appear when they are babies and progress quickly, while for others, they may not appear until they are teenagers. Across all childhood dementia, however, there is one common feature. Childhood dementia is progressive. This means that over months, years, or decades, children progressively lose skills they may have already developed, like the ability to write, read, talk, walk, and play. Over time, their brains also lose the ability to keep the body functioning properly and, eventually, to keep the body alive. There has been so little investment and therefore limited research into treating childhood dementia. Because of this, most children with childhood dementia die before turning 18. Families impacted by childhood dementia experience many losses. Most significantly, the child loses their future. They lose the opportunity to grow up and experience their adult life. So, how common is childhood dementia? 1 in 2,800 babies are born with a condition that causes childhood dementia. It's estimated that currently 700,000 children and young people globally are living with childhood dementia. So what can be done? Well, the first step is happening right now. By making people aware of childhood dementia, we can improve diagnosis, care, research and quality of life for children and young people with dementia around the world. Together, we can make change.
So welcome to those who've just joined us while that video was playing. So just to recap, childhood dementia is an umbrella term that encompasses more than 70 rare genetic conditions, all of which essentially are life-limiting from the point of diagnosis, with very little research that has taken place in the therapeutic world. So we're really lacking effective treatments and cures for these conditions. 1 in every 2,800 babies born will have a condition that causes childhood dementia. That's a similar number and incidence to those impacted by cystic fibrosis. Emerging evidence is actually telling us, and this will be published in November, a new a refreshed burden study, but which will have some updated statistics, that actually the average life expectancy with children with dementia is 9 years old. Largely a paediatric condition, around sort of 80–90% will sadly die before their 18th birthday, but some children having to make that transition into adult services, which we know is a really challenging space as well. For me, I think it's these statistics that I find particularly alarming and heartbreaking. Around the world, childhood dementia takes a life every 11 minutes. In Australia, that means around 90 children and young people dying every year with childhood dementia, which is a comparable number to those dying in the under 15 age bracket from childhood cancer. So just so much to do, of course, in preventing these deaths with effective treatments and cures. And these are the areas of our focus as the Childhood Dementia Initiative. So we started 3 years ago in response to these statistics being published. Our focus is in 3 areas: increasing awareness and advocacy. Without awareness and understanding, we can't create any change. So that's number 1. And then, of course, what families talk about are both these challenges. There are no effective treatments and cures. So we're really advocating for large-scale research funding and for researchers to operate in a more collaborative way, looking across conditions that cause childhood dementia. And we're doing that at a global level. And that continues to be a developing area of our work. And then what the topic of this webinar is around improving care and quality of life. And so much of what we need to do is to evidence and understand what is happening in order that we can advocate for change. And that's really what this We Don't Fit report webinar is all about. Let me first just talk a little bit about these wonderful families and all of the families that generously share their experiences with us here at the Childhood Dementia Initiative. This is the heart of what we do, and it is why we exist. We have a family advocates program with more than 70 individuals that represent families and children impacted by childhood dementia around Australia. There is no commitment, there's no expectation when you join the advocates program. We simply let people know the opportunities to share experiences, and that might be through the media, which some people do take up that opportunity, but it is equally through interviews, through surveys and research, through focus groups, and other means as well. And of course, it might focus in on a particular subject area, whether that's care and quality of life, like we're talking about today, and there's also opportunity to be involved in research and other project areas as well. So if you or somebody you know might be interested in knowing more, please get in contact with us. But I think the absolute vital piece here is that what we are doing as an organisation is representing the voices here and doing our absolute best to amplify the voices, experiences and needs of families around the country. So some of that, well, all of that is what this report was all about. So this report, to be honest, was inspired by one of the many conversations I've had with families. A mum a couple of years ago who, when she was describing the care for her child, she used the words, "I feel that we don't fit." And she said, we don't fit in the disability space, which is set up to support children with static conditions to reach their potential. And that's not really, they don't understand regression. It's not working for my child. We don't feel that we fit in palliative care because my child is going to live for a number of years and we don't see end of life anywhere close in our future. We don't feel that we fit in the children's hospital, who can't really offer us anything and don't seem to know very much about my child's condition. So we feel lost and we don't really know where to go. We're the ones managing all of this. And I heard, you know, nearly every family that I've spoken to describe a very similar experience. And we knew that we needed to evidence this so that the wider world could understand what's happening for families impacted by childhood dementia. And so we wanted to do that quickly as well. So we partnered last year with the Nous Group, who are an international management consulting company, who have a low bono program, their community partnership scheme, and who have generously undertook this project and actually donated a whole lot more hours than they had initially anticipated as they really got to grips with childhood dementia. And what they were tasked with was to run a series of interviews. So this is the methodology, a series of interviews with parents around Australia, both currently caring for children impacted by dementia and bereaved parents. And the focus of this report and this research is to understand the interactions specifically with care and support services throughout the course of the family's experience. And I guess I just want to highlight that this report doesn't try to capture the emotional burden or financial burden and so on. It's really focusing around the interactions with care and support services, even though it touches on those challenges as well. What the Nous Group did post those interviews was analyse the interviews and identified common themes. They developed the typical journey map, which I will talk through next. And then they explored some of the common themes and included recommendations for improvement. It's a pretty easy to read report. I'm going to introduce some parts of it, but I'll certainly encourage you to download. It's only about less than 20 pages long and really digestible. So if you're interested in seeing the detail of it, I'll connect you to links so that you can download it. I'm sure we can even post copies out if anyone wants it hard copy. So this is what they came up with by way of a summary. And I will say that this is, of course, a summary of a typical family experience. Every family experience of childhood dementia is unique, of course, but there are common features that we hear over and over again. And that's what this diagram is aiming to present. So I'm going to talk it through, and I'll start at the left here in the red and move across to the yellow. So this is what typically families experience over the course of many, many years. So life is travelling along as expected, and the developmental milestones of their child are being met. Everything is, you know, as expected with a young family. And then parents begin to see some troubling signs, minor developmental issues, but that are a little worrying, and they start searching for some answers. And parents describe going to many, many different specialists to try and find those answers. They might start with their GP, referrals to paediatricians, and then on to other specialists. They often receive misdiagnoses through this time, quite commonly autism, ADHD, and other diagnoses that aren't actually correct. And often mum, but parents tend to sort of feel that the diagnosis doesn't quite fit what's happening for their child, and they continue to search for answers. This can go on for years, and parents talk about feeling that they are the neurotic mother that can't sort of take the diagnosis that they've been given, and they feel that they are not listened to or heard by the health system. And this, of course, might be through both the public and private system. And we hear of parents talking about being referred to parenting programs and being referred to their own psychological support, for caring for their child, rather than listening to what is happening for the child who hasn't got a satisfactory diagnosis yet. And as I say, that can go on for a number of years until finally a breakthrough happens and a knowledgeable specialist makes a referral for genetic testing. And this seems to be fairly by chance, that somebody orders those genetic tests rather than something happens systematically. So after a number of years of these, almost mistrust, I guess, and challenges in accessing and navigating the health system, the answer comes, and it's a devastating one with a life-changing diagnosis, which everybody, of course, has their unique diagnosis story, but over and over we hear that it's a fairly often an unsatisfying process with little empathy, maybe a poor and not appropriate environment, and often with no clear next steps. So then the treatment journey begins. I say treatment journey almost a little cautiously there, because families certainly report that they sometimes don't even know what the next step is. They don't have a next appointment. And they feel often quite left alone to figure out what the next steps and different supports might be. Inevitably, parents become the experts in both their child's condition and the needs of their child. And quite often this can even be internationally, connecting with other medical professionals, understanding best practice, emerging treatments, and bringing back that knowledge to the treating team here in Australia. At the same time, parents become project managers. Managing care needs is a full-time job. It's the administration of every system. It's the constant appointments. And all of this, of course, is at the same time managing jobs, managing a household, managing siblings, and so on. Parents then talk about that fight intensifying and the psychosocial impact on the family being overwhelming. Many families becoming just one person working, moving home, many changes that are needed to be able to continue that support to their child. And this, of course, is all while grieving all of the losses associated with childhood dementia. Nearly every family, or universally, families do access the NDIS, which is described as vital support. But equally, all families talk about the challenges of getting people to understand what's happening for their child, the challenges in accessing the support that they need to, and really do talk about fighting that system as well. Paediatric palliative care is talked about really positively. Of course, it is different around the country, what service is available and the capacity. One mum talked about it as the whole health system, whole experience of the healthcare system changing when she connected with the palliative care team, and that the levels of understanding and empathy were like nothing she had experienced in the health system for years to date. In some areas, there's a level of care coordination from that palliative care team. But again, parents really wondered why they hadn't been referred to palliative care earlier, and that's an issue in the system as well. As the years continue, families will very sadly have to face the death of their child and that end of life phase, and the absolute devastation of living without their child. And alongside that, there's a community lost. So for families, might have a care team both in the home, in the hospital, and that those people can become a huge part of family life. These are people who know the child, know the family and the siblings, and all of that falls away once the child has sadly died. And then bereaved families talk about that slow rebuilding of purpose and identity post the death of their child. And after many, many years of, the child caring for their child, there's a number of many years of trying to rebuild what life looks like after this whole experience. And of course, I must highlight here that because these conditions are genetic in nature, a family might not experience going through this only once. They might go through it twice, and in very rare circumstances, even 3 times. I want to hand over to families for them to share their voices now. So, and as I was talking about some of that, bereavement phase and post-bereavement, Peter and Hamish always spring to mind. They talk very generously about their experiences of both the death and post-bereavement of their child Mia, who had childhood dementia caused by Batten disease. So I'll hand over to Peter and Hamish. In this video, they're talking very specifically about the value of palliative care and what it meant for them.
So we were referred to palliative care pretty early on when we moved back to Australia. We met the palliative care team at Randwick, and then we were also linked in with Bear Cottage, which we're fortunate that we lived very close.
Yeah, I think when we first were diagnosed, like getting introduced to terms like palliative care is a learning experience, together with, learning about all the other aspects of the rare disease that your child has. So it's really about trying to get a sense of what palliative care is and how it can help us through Mia's journey. And my preconceived idea of palliative care was always sort of very much end of life sort of help, whereas I think Bear Cottage and Sydney Children's were quite helpful in kind of helping us understand how they can help actually from the outset of that diagnosis rather than right at the end. Having said that, they were amazing at the end of life. Bear Cottage was amazing.
So Bear Cottage went out of their way to support us for Mia to die at home, and we felt they were really intuitive about our wishes. We had some obstacles with other palliative care clinicians at that time, which was really difficult. But we also had some amazing experiences. Hammond Care, who were referred to by a neighbour who'd had some involvement, stepped in for some caring overnight and were phenomenal. And Bear Cottage, and also our GP sadly kind of fell away at that time, the crux of when we really needed some support and some documents signed. But thankfully our paediatrician both stepped in along with the nurses at Bear Cottage and the team at Hammond, and meant that we had a lovely support network. So it wasn't always, I think, you have to find what works for your family, and we were lucky to have different points of access that ended up supporting us. I think it was really positive to have a relationship with palliative care that preceded Mia getting really sick. And I know that must be really confronting for families, but it was really helpful for our family to have that pre-existing relationship before we were in, very vulnerable personal space. And we could also feel confident to convey our wishes and not feel dictated to, which I think was the fear because of the big systems in hospitals and processes.
So always so grateful to families sharing on video, which is not an easy thing to do. And I think Peter and Hamish really shared quite a positive experience of the services they had around them at Mia's end of life. I think it's really interesting listening to that, to Peter talk there, especially when she highlights sort of some of the challenges that they still had, and the GP falling away, the difficulty with some palliative care specialists, And I also think it's interesting that there's a number of services around. She actually talks about 3 or 4 different services that no doubt mum and dad were still having to coordinate themselves. Hammond Care being really supportive, but that was a referral from a neighbour. So wonderful that they had that support. But again, it's actually not the system proactively providing that support. It felt like that was more something that happened by chance that was really beneficial. But I think as a system, we can do better in making sure that all of these are available to every family. These are some quotes that are throughout the We Don't Fit report. It really is very, it really shares individuals' experiences against all of the key themes in the patient journey that is talked about. You'll see here the top left, my mother's intuition told me that there was something wrong. I was dismissed multiple times as a neurotic mother, including by my GP and the paediatrician. And I think nearly every mum that we have talked to would nod along and say that that's exactly how they have felt. And I know there's some mums on the line who might share their experiences. Here, another parent talked about repeating the same story every time to new doctors is really hard, especially when the disease is so complicated and rare, and it's even worse when they don't even listen or respect the knowledge that you've gained. So a lot coming out around those individual scenarios, connecting with health professionals, and that's also, I know, extends to social care professionals, families having to talk about and explain what's happening for their child over and over again. And in some cases, that's also them needing to not simply educate, but have to absorb the response and the reaction of some healthcare professionals that might be not so appropriate, might be very emotional. So it's sort of those everyday challenges that just really exacerbate all of the issues that families experience. And then this final one here around that post-bereavement. So a family shared, you've had such a big team around you. These support workers would be sitting at the dinner table with us, reading a story, and suddenly all these people are gone. Paediatricians, schools, it's a really bizarre absence. This was the community that knew your son, and suddenly it's all gone. Just such huge loss and grief throughout the course of these experiences. So the Nous Group and the report, if you delve into it, then looked at summarising all of these experiences into 6 themes that I guess are the sort of the buckets of issues or challenges where we can focus in on each of these themes and develop ways in which we can make some changes and improvements. I'll run through these 6 themes very briefly. So theme 1, conditions that cause childhood dementia are rare, difficult to diagnose and diverse, which combined with low awareness results in delayed diagnosis. Theme 2, following diagnosis there's no defined care pathway and parents find it difficult to access and navigate the various health services and supports that their child needs. Theme 3, parents inevitably become the project managers for their child's care, an all-encompassing role with a high administrative burden. Theme 4, paediatric palliative care can provide comprehensive care and support, but it's not consistently accessed. Theme 5, NDIS packages are an essential support for families, but are universally challenging to access and manage. And theme 6, that following the death of their child, families find comfort in informal and formal supports, yet these can be difficult to access and sustain. So just a huge amount in this, and this is of course just one sort of relatively short piece of research. So much more to do to delve into this, but equally enough insight to understand that there is so much that can be improved upon. So this is some of what we are continuing to do as well to build this picture so that we can keep advocating for change and building that awareness and understanding. The evidence base is really important to create change. So delighted to announce that earlier in September, this article was published. We commissioned the University of New South Wales to undertake this for us. And it's a systematic review looking at the psychosocial impact of childhood dementia on children and their families, the first of its kind. It looks at all of the global literature, and as you can imagine, it actually reinforces exactly what was found in the We Don't Fit report. So it talks about families not being able to access knowledgeable health professionals, not being able to access quality information, and have this increasing, ever-increasing burden of care that is extreme in the absence of appropriate care and support systems and services. So this is all about us building this picture so that policymakers and practitioners can respond to the issues at both the systematic level and individually as well. And our role is very much around the systemic advocacy piece. We have partnered with the University of New South Wales to continue to develop the evidence base, and they will be undertaking an Australian study, both qualitative and quantitative, which means there'll be a survey and there'll be interviews of families on a national basis to delve into the psychosocial impact of what is happening here in Australia currently. So that will look at both emotional, psychological, financial, and other issues that or other impacts of childhood dementia, so that we can really quantify and use a lot of statistics and statements to, again, galvanise government and policymakers and those responsible for changing systems to focus in on this area. I've got QR codes in the next couple of slides for you to join us to stay updated. If you don't receive our updates, we send an email sort of once every month or 2 months, keeping you up to date with emerging research like this and our other work as well. So I'm coming towards the end of me talking, and I'll hand over to all of you. I've just got a little bit here to share, another family video about some of the, again, immediate work that we're doing to create some change. So as well as garnering this, this evidence base and using it to advocate at government level, and we've been delighted that we have been funded by the Department of Health to run these projects and to continue to investigate what is happening for families. So we're very lucky to have a voice to the Department of Health. We are also building a very large healthcare professional network who are keeping up to date with this research. And this was a piece of work that we did with families to look at what would be the top requests on how health professionals can work better when they're working alongside families. And we've heard even from Peter just about, it's not, there were some challenges working with some of the health professionals that she worked with, and through the patient journey, just some of those aspects of lack of empathy and understanding of the whole, all of those impacts of childhood dementia, both through the course of that journey, which starts well before diagnosis and goes on, really ongoing. There is no end, for families. But this was a project that was around families and giving some insights as to how health professionals could work better with them. So you can download this PDF, and we can also probably post some out to anyone who's interested. For families, this might be a great one to give to treating teams or to any sort of care teams. And for any health professionals on the line, please feel free to post it up on a notice board, just as some reminders. It's really pithy, and you'll see the top 5 requests here. So number 1, treat us with respect, care, dignity and kindness and provide some hope. Number 2, acknowledge we are the experts regarding our children. Number 3, recognise the impact of childhood dementia on the whole family. Number 4, do some research to understand more about childhood dementia. And number 5, use your knowledge of my child's dementia to provide appropriate care. And what we did when listening to families through focus groups for this is we presented this in the one-pager, but there's also videos of families talking to every one of these points. And in those videos, they share not only why these points are really important and the requests are really important, but some examples of good practice and what families have experienced, so that health professionals can know what it is that they might need to do. And I'm going to share one of those videos here. This is episode 1, where families are talking about providing health professionals being respectful, providing care, kindness and hope. So this is around a 4-minute video, I think, and that will bring us to the end of the presentation.
I want to be treated with kindness and respect. showing some warmth and empathy to the situation that we as parents find ourselves in.
I want to be treated with patience and consideration for how challenging things are, at the same time as being respected for how much we do manage.
I wanted to be treated with kindness and dignity.
I wanted to be treated with respect. Respect for us meant that you understood how many doctors, therapists, treating people that we were seeing, what your role in our child's life was, and how you could best help us get the best outcome for him.
You can treat parents with dignity by listening to what they need. I experienced this when one of his specialists always asked my husband and I how we were travelling before they asked about our son.
You can show respect, care and kindness by really taking the time to listen, confirm your understanding and follow through. I've experienced this when our therapists take the time to get to know us and work alongside us. It's important because this is the most important thing in our lives.
So the one thing for me is to never underestimate the impact a small gesture may have. I experienced this one Easter Sunday when my Eddie had been in hospital for some time. He was incredibly unwell. He was connected to an enormous amount of medical equipment, making it very hard to hold him or be near him. And this nurse took the time to help me bath him and dress him and then let me sit in the chair and hold him. And I will never forget, her name was Emma, and I could never forget her face.
You can do that by valuing families' time, understanding their child's needs, making adjustments where required, and doing what you can to confidently and comfortably talk about the reality that they're facing.
It's important because we as parents are grieving every day for the life-limiting condition that our children have, knowing that they're not going to reach the full potential that they could, and that they're going to be taken from us well before their time.
I think it's very hard for people who haven't been in our shoes to understand what hope looks like for a family like ours. But for families like ours, hope might mean something like hope that your child's not going to suffer, hope that if he's in pain, you'll be able to tell us and you'll be able to treat it, hope that his life will matter, that it will have meaning, hope that he'll have happiness, and maybe just hope that he can still smile in a year or 2 years. Simple things like that are probably different to most people. I think when people are faced with old age, they always use the Dylan Thomas quote about not going quietly, right? Raging against the dying of the light. Help us do that, because that's what hope is. Teach us how to rage against the dying of the light.
Seen that video many times and it still packs a huge punch. And I think this is those videos, there's a series of them, there's 5 of them, that for anybody who wants to share those, they're all on our website, they're all on YouTube. Everything that we create is to be able to be shared. And happy to guide anyone who needs would like to share those around and how they can find them and what they can do with those. So just by way of sort of finishing up me talking, by next steps in all of this. So it's very clear from all of both the We Don't Fit report and the emerging academic research and the parent voice that we hear every day here at the Childhood Dementia Initiative, that there is an urgent need for systemic change, and that we are investing in further research which will continue to build the case for change. And I guess our approach is to sort of work from both a bottom up and a top down approach to create change. So some of our next steps are developing a community of practice for health professionals who are working alongside families, so that health professionals can connect and build a national network and begin to really bubble up that best practice of working alongside families and take on some of that need and case for change themselves. While at the same time, as I said, we have a voice to the Department of Health, who we are working with to further explore the current situation, and we'll be doing a lot of work in 2024 around that, around what current services and supports look like and how things could look better. So I would love to encourage you to join us and stay updated. There's a QR code there for you to follow through, share your voice, whether you're a health professional, researcher, family, always keen to hear directly from people and to hear what we could be doing differently, could be doing better. There's a QR code there that will link you through to download the full We Don't Fit report. I'll keep those QR codes up there, but thank you very much for your time and for listening through the course of a whole heap of information that I guess has been laid out in the last 45 minutes or so. I'm just going to have a look at the comments that were made in the chat, and I would love to hear any thoughts or questions from anyone at all. I've got here Catherine on the messages. Haven't seen such a great video. Thanks, Catherine. Everything, we have a load of videos on our YouTube channel. They're all through our website too, which is Bear Cottage equivalent. Sorry, I'm just looking here. Question from yourself. From Amy, is there a Bear Cottage equivalent in Queensland? Yes, and thank you, Trish, for responding. There is Hummingbird House. Is up in Queensland. So, and Amy, yes, you can absolutely ask a question. Have you just asked that now? You're on mute. Let me unmute you.
I just wanted to ask, because I mean, that was such a great presentation. Thank you. And absolutely, we just don't fit. I don't know how big the community is within Queensland, but I personally, my experience, I mean, I'm connected with the Queensland Palliative Care team, but I had a meeting with them, a few months ago, and I just asked the question, you know, in the community, within our community, do they have connections with mental health and say psychologists who have experience or are more focused in this area, and it just blows my mind that the Queensland director, there's just nothing. There's no names that he could provide me with people that are in our community that have experience with this, and I think that's absolutely something that needs to improve. I work within NDIS. I'm a support coordinator for families, and I work with other conditions like Duchenne muscular dystrophy, which is a degenerative condition. And so it's not just this community. There are a lot of other kids, and they have progressive conditions, and it is an absolute struggle for every member of that family. I would like to connect with someone personally who actually has experience, not just, a generalist. So if anyone's got anything to add, if there's anyone on here that is from Queensland, doesn't have to be in this meeting, but maybe I just am not asking the right people. But I've actually got a call with Dr. Herbert, the Queensland palliative care specialist, today, and he said that he would come back with me with some information. He took it on board, that feedback, and he said he hoped that in his next meeting with me, which is actually today, that he might have more to share in that space. So if I learn anything, I'm happy, I will definitely share it. But if there is anything anyone knows, that would be great.
That would be great, Amy, and keep us up to date with how that conversation goes. I definitely think it's worth asking about Hummingbird House and who the professionals are there that might be available and so on, because I know their resourcing might be challenged, but I know that they also aim to have some outreach and community support as well. So I think, you're right. There's two things. Firstly, there's often no systems and services, and not even every state has, an evolved palliative care team or a children's hospice. Like, they're at very different stages around the country. But it's also the fact that because these conditions, and until now, until bringing them under one umbrella, they've been so dispersed through the health system that there's no central parts for expertise. And we hear this from parents often, that they can't find people who are knowledgeable to provide support to families, children, siblings, and so you're sort of left starting with scratch with a professional, really, aren't you? Which is
I think they're out there, though. I just don't think they're connected.
Yeah.
I did hear a tip too from someone just recently about Siblings Australia, that is support out there too for families. Just wanted to add that. I'm going to look into that, because obviously, the siblings have a journey as well.
Yeah. And can I just add to that? Like, I think if you contact the Australian Psychological Society, you may find there's a group of psychologists that are health-related psychologists. So you might not find specific, childhood dementia per se, but you may be able to link in with someone who has a background in a number of different, illness types and things like that. It's like anything, you've got to find someone that fits. It's hard to find a good GP. You move around, try and find someone that you really relate to. But I'd recommend get on their website and have a look. I'll try and post it in the chat if that helps.
That's great. Thank you. Thank you so much.
Yeah.
Thanks.
Can I just say, Gail, that was fabulous. Thanks. I think we just need to disseminate and get as much information out as possible. So yeah, that was great. And your whole team, fantastic. So thank you.
Thanks, Catherine. Thanks for your ongoing support. Catherine's worked in this space for a long while herself, based in Melbourne. So certainly has your insights into both the systems and family needs, Catherine, I know. So thank you. Anybody else? Deanna there with baby Tio. Hello, Baba. I'm just going to reply, Stephen, to your comment here in the chat. Did a copy of the report get submitted to the current NDIS review? So we're really delighted that we're working quite closely with Dementia Australia. So a lot of our advocacy work is around acknowledging, and the world acknowledging, that dementia is a lifespan condition that can happen from anyone to anyone of any age, from birth, all the way through to older years. So Dementia Australia, who are very well known for their advocacy work, included the specific needs of children living with dementia in their submission to the NDIS review. And that will continue to be a piece of work that Dementia Australia do, expanding all of their advocacy and voice, and ultimately we hope a number of their services to children with dementia as well. We're only a small team, and our aim is to catalyse change. So getting bigger bodies like Dementia Australia to take action on behalf of children is really key to success, I think. So that's the approach we took there, Stephen. Hope that answers your question. Any questions or thoughts from anybody else at all? Really happy for anyone to chuck anything in the chat, if that's the easiest. And I'm hoping that we've sort of directed you to all the useful links and so on, but really happy for anyone to pop me an email if you want anything hard copy or not sure where to find anything. Our aim is that all of this, including this presentation, I've recorded it and we'll make sure it's available online. Video, report, all of the family videos, please feel free to share them. We don't see ourselves as the owners. They are for everybody, to help make them go far and wide. As you know, this is all about awareness and deepening that understanding across professionals and researchers, policymakers, and so on. Amy, of course you can raise one.
Sorry, just on the NDIS point, because I'm working as a support coordinator in that space, but I manage my own daughter's plan. I'm happy to share my details with you later in case anyone wants to get in contact with me, because I've got quite a bit of experience in that space. But having said that, one thing that I was met with by the NDIA, which was, I thought, quite appalling, is that they cannot, the wording was, they can't predictive plan. So they cut my daughter's plan like by 75%. I mean, I challenged that and was successful in getting it back, but yeah, they're trying to push this line of we can't predictive plan. Now that I think there's, if anyone gets that, there's ways around that. I just want to say, yeah. that was
Amy, and I know Joe's online there. You know, Joe's our wonderful manager of our lived experience program and manages the connections with families around the country. And we are absolutely also looking at ways in which we can support families who are advocating for themselves and their child, as well as the systemic advocacy and change that we need. And I think really in 2024, we're going to have a massive focus on the disability space, I hope, because I think there are things like that with, you know, some changes could make the world of difference to every family around the country.
NDIS has been life-changing for my daughter, and I'm very, you know, grateful, and she has an amazing plan. And but yeah, I know that it's a very challenging road for families. So if I can share any experiences on that, I'm happy to.
Thank you. And Daisy, Daisy's online also, who has lived experience and works in the disability space. Also happened to share early childhood space as well. Also happy to share support and information. So it's wonderful to know. And I know that peer support and giving insights is such a vital part. That we're looking at ways in which we can enable that as an organisation as well. So, and Jo has many things on her list, so we'll keep connections as an absolute priority for sharing this sort of information. Marjorie, you've just asked, you sharing information with departments of education in the States. We have a really quite a huge health and social care and educational professional network. I don't know if we have representation from departments across all of the states. So if you have any distribution lists or ways in which you think we can best do that, really happy to have that conversation. It's for us, a lot of it is about finding the right people and the right ways of disseminating information. That's a huge part of our work. So any thoughts are really appreciated. All right, we've just got 2 or 3 minutes left. So if anybody else has anything they want to add, please feel free to shout. And if not, I will bring the session to a close and just say again, thank you very much all for your time and for logging on and finding out a little bit more about childhood dementia and the impact on families, and hope to see you all connected at future sessions, and I'm really happy to enable and support you guys in the work or the lived experience of what your connection is with childhood dementia. So please stay in contact. Thanks, everyone.
Bye.
Thank you. That's great.
Thanks, Stephen.